If you or someone you know is fighting atrial fibrillation or AFib, it may be comforting to talk to a cardiologist who has dealt with it firsthand. Dr. Charles Lampe with Texas Health Physicians Group joins us to have a heart-to-heart conversation about what symptoms to look for and what he can do to help you. Thank you. Good to see you.
Thanks for having me.
You are a cardiologist with a unique story to tell, and I understand it starts with the Texas Rangers being in the World Series. What's that about?
That's right. My father and I had World Series tickets, but I'd actually gotten sick that day. Still went to the game, but developed some palpitations for about 30 minutes during the game. That was probably my first episode of AFib, although I didn't realize it at the time. Mainly with exercise. Symptoms were mild, very easy to ignore. I thought it maybe could be AFib, but I really wasn't able to catch it on an EKG.
You notice the symptoms easily because of a watch that you wear?
Yeah, the symptoms continued a few times a year. Again, really wasn't sure what was happening until I got the Apple Watch. When I had my next event, the Apple Watch suggested it was AFib, and I was able to confirm this with my cardiologist when I conveniently went into AFib on my stress test a few weeks later. So the Apple Watch is a great way to warn patients that something might be wrong. But like I had to do, it needs to be confirmed with your doctor and maybe even some testing.
Right.
When my symptoms became more frequent, I considered my options and ended up having a procedure done. It's ironic that I would have AFib, as this is my most common disease that I manage, but it allowed me to connect a little bit better with my patients.
So I can imagine getting a diagnosis as a doctor. It must be a tough one to deliver to patients. Does hearing your story help your patients through it?
It does. They like to hear that even I had some trouble figuring out what was going on. They like to know that I went through the lifestyle modifications, tried to lose some weight, went through some medication options. And it definitely helps my patients to know that I considered the ablation procedure, what things I thought about before I had the ablation procedure, and then to hear my experience with the ablation procedure. The AFib was significantly affecting my quality of life. My wife would always tell me that I was in a bad mood when I was in AFib. And so, that pushed me to have this procedure done. And so far, it's worked out real well for me.
So you said earlier that the symptoms were hard even for you to recognize, and you're a doctor who deals in this. What are the symptoms of AFib that people should be aware of?
So AFib is a rapid heart arrhythmia, and although symptoms can be mild, most people can tell that something is different. Fatigue, palpitations, mild shortness of breath, especially with the exertion, are probably the most common complaints I hear, although some people have no symptoms. They have no idea they're in AFib, and the diagnosis is made incidentally. Other patients have severe symptoms like chest pain, more severe shortness of breath, dizziness, or even passing out. So if you have some of the risk factors, such as being overweight, having high blood pressure, sleep apnea, or other heart conditions, and have some of these symptoms, then definitely talk to your doctor about being evaluated for AFib.
And most important, how's it treated?
The most important treatment is to see if a blood thinner is needed, as AFib really does increase your risk for having a stroke. Not everybody needs to be on a blood thinner, but most will. We'll also talk about lifestyle modifications, such as weight loss, minimizing alcohol intake, treating high blood pressure, sleep apnea, and diabetes. And then we offer medications to try to prevent the AFib episodes. But more and more, we're offering this ablation procedure like I had to treat AFib without the need for long-term medication. This procedure has become very effective and is now a very safe option, and more people are now candidates for ablation. We even had good success treating older patients who are more commonly have AFib and previously weren't offered this procedure. We've actually successfully treated a number of patients in the early 90s with ablation. So I'd recommend discussing the treatment options with your doctor or heart rhythm specialist and see what is the best treatment for you.
Thank you so much for the great information this morning. We really appreciate it. Stay safe and healthy.
All right. Thank you.
Call 866-241-2866 or go to thpg.org/heart-to-heart for more information. You can also go to facebook.com/Texas Health Physicians Group. Still ahead,